I'm just going to clean your skin with some alcohol just to prepare it so we can put the anesthetic on. Just breathe through your mouth when I get closer to your nose. Okay? That's a cream, and we use Elemex, and we're just going to put it over the areas where we're treating, and we leave it on for about 15 minutes, 20 minutes, until it's all nice enough. And Christine has had this treatment before, so we know she's got no problems with local anesthetic. Do an electronic derma stamp, or as we call it here at London Bridge Plastic Surgery, intensive microneedling. And we're going to do it around Christine's mouth, because what we're trying to do is to soften, define the lines above her lip, and work also on these cheek lines here. She's had a few treatments and she's had a really good result so far. You can see the difference in the lip lines. Those lines came all the way down to the lip line before, so it's progressing really well and she's very happy with that. This is what we use. It's an electronic derma stamp from Derma. Basically, what you can do is you can adjust lots of things really. You can adjust the length of the needle, which it shows you that changes the length of the needle, and we can change that. And this is our little machine. You can adjust the depth, how many, so it's set at the moment to go 80 needle sticks a minute, so it's much faster than I can possibly do by hand. It's a very comfortable treatment, much more comfortable than actually doing a normal derma roller. And yeah, so we're going to start, and so I'm just adjusting it to the settings that we've worked out for Christine. Before we go onto the skin, we use some hyaluronic acid, which comes with the derma roller, and then we also use some peptides and vitamins called their CTI solution. So having put the holes into the skin with the derma stamp, these solutions can get really deep into the skin at the same time. So not only are you stimulating collagen, but you're also feeding the skin and hydrating the skin. So I'm going to put this on first. So basically you have to keep it rotating and moving quickly over the skin, and you can see how quickly you get a response in the skin, and you get little bleeding back, and then you can see an inflammatory response coming through. And that's what we work towards, to getting that. And in the skin is what's going to create what we call control damage and have a new change coming through. So it's a very quick procedure as far, and on the upper lip it's a very comfortable procedure, which in a lot of cases usually isn't the case, because to get that kind of response usually is quite painful. Moving, the great thing about it is it's one machine, and you move to a different area which is a bit more meaty, so we can change both the needle length and the speed, and try and get work on these deeper lines. You can actually work quite close to the eyes, because you can turn the needle length down to being quite gentle but still effective in treating the lines closer to the eye, and it's still very comfortable for the patient.
At the moment it just feels like a little bit burning, but that settles down in about half an hour, and then you don't feel anything after that, just a little bit of redness, and that's all. in a couple of days it just goes.
We use this amazing product called Oxygenics, which mixes with the moisturizer. It's a concealer, moisturizer, sun protection, healing, everything that you could really want, really. And it's really good for just bringing down the red after the treatment and making it so that the patients go out not looking totally beaten up. And we can use it straight after any needling or any lasers or anything like that, which is not often that we have a product like this that we can use straight on.